Today I'm addressing you who they are very much interested in taking the field of hair restoration surgery. Once you make your mind, you should make your mind sole mind for hair restoration surgery. This is a big field. If you enter into it, it will be a very fantastic for you, amazing field, and very interesting one. But my advice to doctors who they are coming into the hair restoration surgery, either from general surgery, plastic surgery, or dermatology, or any other specialty, then you need to decide only one thing. First of all, one thing: forget about your background field, forget about your background specialty from where you are coming into hair restoration surgery. This is bigger than any field, bigger than any field. You need to learn the anatomy and physiology of hair only, scalp only. Okay, you need to be into it. You need to know about the anatomy, physiology, and then pathology. Then you need to know the histopathology of hair diseases only. This is not a very small subject. If you enter into it with a great passion, very honestly, you will not be finding a minute out of it for your own life even. When I come into the clinic, I tell you my routine at 7 o'clock, half past 7 max, and till 6 o'clock in the evening, I have not a minute free from my patients, and I do only hair restoration surgery. You know, you need to be a clinical doctor, you need to be a clinical surgeon, you need to be a practical expert in that field of hair restoration surgery. You need to know all the procedures related to hair restoration surgery, and you need to know all the medical treatments of hair fall solutions. I will elaborate on many things related to hair restoration surgery. It is not hair restoration surgery. Female hair losses, male hair losses, genetic androgenetic alopecia in male, androgenetic alopecia in female, polycystic ovaries syndrome in the female, and female hair losses have 90 reasons behind that, and male hair losses is 95% of the genetic loss, and 5% is so many losses. Most of the times you will be surprised, and you will see, oh, what can I do with this? Should I refer to this person to the dermatology? Should I refer to this patient to the plastic surgery or general surgery, or so on? So my advice to you is, first make your mind to be a hair restoration surgeon, then start thinking about training in the hair transplant surgery. And this comes a big thing for you. When you make your mind, then you need to find a best mentor for yourself. Don't start with minors. Don't start with technicians. Don't start with the people who they are confined to only one way of harvesting the donor area. No, you need to know every way to harvest donor area safely, because keep in mind, if most of the patients coming to your office are male genders, 30% in my office they come to female gender. But in my office, I'm very lucky and fortunate to have Dr. Uzma Irfan in my office. She deals mostly with the female patients. But in her practice, 70% of the female, they come for hair restoration surgery, eyebrow surgery, eyelashes, this. She is having a big entity of patients with the female hair losses, and management of that is very different way. So when you will be entering in this field, then you will be finding a big mentor for yourself who will guide you positively on every aspect of the hair restoration surgery medical treatment, many ways of donor harvesting, grip on the surgical techniques, and many ways of harvesting FUE and FUT procedures, because in male gender, hair fall starts at early 20s and it keeps on going till 80s. You know, you need to cover that 60 year of that patient with medical treatment and surgical treatments. It is not a single sessional surgery, and you should not be making it as a single sessional surgery. It is multi sessional surgery, and you need to be very clear on that it keeps on falling for the whole life, and you have to manage the decades. Like a patient is coming to 21 to you at 21, you will manage him for one decade to put him in this 30, and then you will start managing him in 30s and put him like in will bring him like to the 40s, and 40s may and in 40s you will treat him like to bring him in the 50s and 60s and so on. So you need to know what will I be doing for him in 20s and 30s and 40s and 50s and like this. This is very much needed. For that purpose, you need to find the best mentor, supervisor for yourself to have a best training from him, because you need to start from the 100, not from 0. From 0 to 100, from reaching from 0 to 100, you will face so many things, complications in the emergencies and in transplant surgery, treatment of emergencies, handling to the emergencies, handling to the complication, what could be, and avoiding complication, avoiding emergencies. This is very much important. So it is not been like weekdays training. No, you cannot be a competent surgeon by weekdays training, weekend trainings. No, you should be at least having 30 or 60 days with the mentor, and then you will keep in contact with him for 2 years at least, so that you should be making a competent mind for hair, to be a best hair restoration surgeon for your patients, because at the end of the day we are looking for safe hair restoration surgeons for the patients. This is very much important, and there should be a bulk of knowledge with you, and you will be guided by your mentors to join the big entities in hair transplant surgery like ISHRS and American Board of Hair Restoration Surgery. You need to be that competent, that certified. You need to be that solid mind to do our best for the patient coming to your office. Thank you very much.